So in the interest of keeping everything patient-centered, we wanted to be a little bit kind of more open and focus it on individuals and their stories as much as we can, but also how we can then innovate more broadly, learning from that. So my own story is a lockdown one. I'm sure we've all got one of our own. In the first lockdown, I sort of, as everyone probably did, grappled with a lot of the kind of emotional, the laziness elements of it, being stuck in the same four walls every day and trying to get into good routines. But eventually I did, and got into a really good program of like regular daily workouts, like walking 10,000 steps a day every morning, and really like understanding how I'm able to kind of stay at my best performance despite that, despite the mental challenges that lockdown posed for all of us. And then sort of late on in 2020, I'd also started introducing a few different things. I started cycling as well as walking because that allowed me to get different scenery, kept me mentally a little bit more stimulated where the environmental change wasn't really available to me. But I guess around September in 2020, I woke up on a Sunday morning with this just severe coccygeal, so tailbone pain, to the extent that I wasn't able to sit all day. It was really awkward, and every sort of the slightest touch on towards my tailbone on any seat was just agonizing, in a way that kind of had me contemplating, you know, I'm not old at all, but this quality of life impact of this thing is potentially quite huge. I don't know where it's come from, but I was also quite despondent at the fact that I'd gotten into this, what I thought was a really good routine of upkeeping my health. I didn't even mention, but my dietary wise, I was keeping quite regimented as well, because it's just, there was no social pressure to eat anything unhealthy at that time. So it's quite easy. But yeah, it was this moment where I hadn't experienced pain quite like that, but also just the quality of life impact of not being able to sit down felt quite severe. That it seems like, you know, you hear low back pain all the time as a concept, and that it's quite common, but that quality of life impact on a day-to-day is not necessarily something that you really understand until you've been through it. And that's always a little bit of a limitation as a clinician commenting on something. And also as a clinician, kind of knowing some of how to manage low back pain, but not always doing it on a day-to-day. My mind went to all sorts of places as to what this pain could be. It had quite a heated kind of feeling to it, and it felt quite inflammatory. So I was worried actually in the worst case scenario that I might have ankylosing spondylitis, which for those of you who don't know is an autoimmune condition with severe kind of quality of life impact longer term. With there being a family history of autoimmune disease, I was particularly concerned about that. But I took a wise decision to speak to a close friend who's also a doctor. Not all of us have that luxury, but my best friend, who's also an ENT surgeon in training, we talked it out, and kind of, I was quite conscious of a couple of things. One was that initial risk, but as we talked about it further, it kind of became clearer that even if I was going to be diagnosed with ankylosing spondylitis, it would be a case of seeing a few flares of back pain over many months. And so that initial flare, even if it may have been, wouldn't have told us anything. I would have been in the process for a long time trying to get a diagnosis. Obviously, at that time, it was super challenging to even get a GP appointment, as it still can be now. So that didn't seem like an immediate avenue for being able to address it. So having discussed it, I took the decision to get some physiotherapy privately, and then move forward with that. Now, what was interesting about that whole experience was given it was in a private setting, there were kind of other treatments that I wasn't expecting to get, but so I ended up having acupuncture, which was previously available on the NHS for back pain, but is no longer, along with some chiropractic, which I wasn't expecting to get. But over the span of about 12 appointments over the span of about 3-4 months, things did start to improve. And as I went through that process, I started to understand a lot more how little kind of joint pains here and there may actually holistically end up either creating that back pain or creating that postural instability, or being able to kind of keep it stronger. And so things that seemed like minor injuries over the course of the years, I've had injuries in my right ankle, left knee, and I had a bit of niggling pain in my right hip that was building up, and my left shoulder as an old injury. They seemed to sort of actually had this zigzag imbalance that perhaps indicated where my low back pain had originated from. I also think that kind of the cycling element of it, and having just started and not necessarily wearing the right cycling shorts, might have been a contributor to that initial pain. But it's the kind of thing that since then, although I've had a decent outcome and have not had a flare up like that one since, thankfully, it's the kind of thing that does kind of rear its head as a niggling pain here and there, depending on my physical activity. So I'm quite conscious of it now. I kind of completed that physio treatment of about 3 months. and have got a couple of preventative measures in place. So you can't see it, but I'm wearing a wearable device under my shirt right now that if I'm kind of sat too far forward or too far back and have bad posture, it's going to buzz and remind me to sit up straight. I'm also using a lumbar cushion to keep a little bit of the pressure off my lower spine. But I have had a couple of little niggles here and there that have required me to go and get a sports massage lately. So I'm kind of proactively trying to take steps to get to being pain free. I wouldn't say it's sort of pain on a very regular basis. It's intermittent and mild, but it's the kind of thing that if you don't keep on top of it, it could worsen. And I'm very conscious of that, given that that initial phase was so painful. So with that, that is my story for now. I'm going to hand over to Alexander to tell us a little bit about his perspective on such scenarios and what they tell us.